First of all, I was invited to join to the mission trip the North Texas Latin American physicians has in Tilapa. So it's a group of Latin or Hispanic physicians. They are willing to serve the other countries in South America. So I think most of the issue was that they find a lot of oral needs in patients when they were there. So they invite me to find out if maybe I can join the group and can help with the dental needs in the population that we were. I was Medellin, Colombia is a little village, rural village in Medellin, Colombia, San Vicente. I decided, like they told me that they have a nursing home there, and they have also several like orphanage. They were in big need, oral health needs. So I decided just do the screenings in both sides, in the orphanage with the children in the orphanage, and also for the nursing home in the village. I found very interesting things with some of the children. So I will be saying like 50% of the children were no decay at all, zero decay. So this is wonderful. In the other way, I found some children they has very rampant decay. Well, when they told me and they invited me, this was a special thing for me because they invited me to go to Colombia. So I am from Colombia, and it was a special thing for me to go there. The place when I visit with Dr. Finn, I never was there, so I didn't know this area exists. So it was kind of new thing for me, but it's very special that we can have the skills enough to help people from other parts of the country, especially in my own country.
She just asked me one day, was telling me about it, and she knew I had a history there because our daughter was born there, our oldest daughter. And she just said, I'm going to go do this. Why don't you go with me? And I thought, well, I guess I could. I didn't have any reason not to, but I wanted to ask my daughter first to see if she'd be interested, and she was just overjoyed with the thought of going. So that's what made me decide to do it. She was excited because this was the first time we had been back to the town where she was born. And so she was very excited, and anytime she has a chance to go, we've been once before just to a resort town, but not to the area where she was born. So she was very excited, and it was very fun for me to watch her get to see a bunch of Colombian, be within the Colombian community, and meet some people and see all those kids, and I think she really enjoyed it. It was a little eye-opening, I think, for her because the laws have changed since when we adopted her. And now it's a very slow, very difficult process. Whereas when we got her, she was 8 weeks old. Nowadays, they're stuck there 4 to 5 years before they are able to get out, in an international adoption, that is. She didn't. The one thing she did say, because we went to the actual adoption center where we met her for the first time, and as we were walking in, she doesn't remember it, but she just kept saying, "This is really weird. This is kind of weird," and I'm sure it was for her. It all looked familiar to me, but not to her. And to see those kids that are there now and that are having to stay there so long, I think she was. It was a little shocking maybe because that's not what she was expecting, nor was I expecting that either.
In summer 2017, we are planning to come back there, and since we know exactly what kind of needs they have, so now we can implement some kind of work, what we can do there for the population.